And he called me and I was driving and he was like, "Hey, Heather." And it's Steve Perlman. And he's a facial plastic surgeon who's really known for his rhinoplasty and rhinoplasty revisions. He's a phenomenal surgeon. He said, "Well, when are you going to be in New York?" And I said, "Well, when do you want me there?" And he says, "What about Wednesday?" I'm like, "Okay, that sounds good." And I'm like, "Oh my God, what did I just do?" So I come home and I'm like, I tell my husband, I'm like, "I have an interview in New York City." He's like, "What?" We're like, "Okay, we'll go." And I said, "I've never been to New York. I'm like a Vermonter, like live in the country in North Carolina." And he's like, "I'll go with you." So we flew to New York and we went into the city and he's so sweet. We took the train and he made sure we found the building so I would know where to go the next day. Fast forward, I spent the whole day interviewing there. And when I left, they were like, "Could you see yourself as part of our practice?" And I said, "I could." So I walk out, I'm like, "Oh my God, I just took a job in New York. Like, what am I doing? I don't even have a place to live."
Welcome to Nursing Beyond the Bedside. I'm Audrey, your host, and a nurse who pivoted my path several years ago. After 8 years as a critical care nurse, I was ready for change. I craved higher pay and more flexibility, but was struggling to find a clear path forward. Fast forward through positions in recruiting, customer success, and marketing, and many lessons learned along the way. Today, I run Pivot Path, a company dedicated to empowering nurses to redefine their careers. This podcast is designed to help you navigate the journey from clinical bedside nursing to a fulfilling career that aligns with your passions and goals. Here, you'll discover inspiring stories from nurses who've gone beyond the bedside, successfully transitioning to non-clinical roles, or redefining their nursing career. Join us as we hear their stories and share actionable strategies to help you make your own leap. Whether you're a new listener curious about what lies beyond the bedside, or a returning audience member in need of some fresh motivation, this podcast is your go-to resource for exploring new opportunities that can transform your career. Let's get started. Today we're joined by Heather Rypien, a seasoned nurse with a commitment to excellence. Heather began her career 20 years ago in the critical care unit and emergency room and transitioned to aesthetic nursing 15 years ago. She's built an impressive career commuting between North Carolina and New York City to work with renowned plastic surgeons. Heather is a national and international speaker, trainer, and advisory board member who's passionate about delivering natural, non-surgical results and educating the next generation of providers. Heather's here to share her journey, the realities of aesthetic nursing, and her advice for nurses looking to pivot into this specialty. Welcome to the show, Heather.
Hi, Audrey. Thanks for having me. I've been so looking forward to this. Congratulations. A great idea.
Thank you. This has been so fun getting to talk to all of these nurses and hear about all of the really cool things that they're doing and the different ways that they're making an impact. So I've really been looking forward to this episode, though, because I haven't had an aesthetic nurse on the show yet. And I know that this is a part of our profession that a lot of nurses have curiosity about. So I'm excited to have you share your story and, kind of the things that you teach and do to keep the specialty moving.
And I'm thankful to you for having me because I cannot tell you how many messages I get from social media, LinkedIn, Instagram, from nurses saying, "Hey, I'm interested. Can you tell me more about it?" So hopefully people will find their way to this, we can answer most of the questions I most commonly get asked, and hopefully that'll be beneficial.
Yes, absolutely. Well, let's do it. I mean, I know that you haven't always been an aesthetic nurse. You were a nurse for a long time before you got into aesthetics. So I'll let you choose kind of where to jump in with your career, but give us a little bit of background.
Okay, so, just the short and dirty, because it's such an interesting story, but I actually was a nurse for only 5 years before I got into aesthetics, but I was previously a flight attendant. So I was a flight attendant. I'm from Vermont, and I left Vermont when I was 20, and I got hired at Continental Airlines, and blind date, met my husband. He was the probably secret to my success in this space right now, my number one fan. But yeah, so he was a pilot, and it just didn't make sense for me to be flying. We had our kids, and after 9/11, I was actually on maternity leave with my youngest, and I was set to go back to flying September 13th when he turned 1. And September 11th came, and we were sitting at home, and he was home with me. And we both looked at the TV and we're like, oh my God. And then Continental Airlines came on and said, you know what? Who wants to take leaves, full benefits? And I'm like, oh yeah, I'm not ready to go back to work. So my sister-in-law was one of the original CRNA grads. So when that program first got started in the country, she was at the forefront. And I'm like, maybe that's what I should do. So I was like, well, okay, I'll go to nursing school. So while I was on leave from Continental, I started taking prerequisites. We lived in Houston at the time, and that was my dream. I want to be a CRNA. Fast forward, we just didn't like the weather. I moved to North Carolina, and I got into the Queen's University or Presbyterian Hospital nursing program. And I was just, that was my thing. I was going to get out. I was going to go into critical care. I was going to be a CRNA. I had my plan. So this pivot in my career was completely expected and has been the biggest blessing. I found my thing, but getting here was nothing that was planned, because back then, aesthetic nursing, I mean, it really wasn't a thing. And, there are a lot of the procedures that are like getting a manicure, pedicure today were taboo and not talked about. And so I kind of fell into this kind of by accident. So I was in critical care, started the CCU, went to ICU, and then eventually the emergency room. And I was like, yeah, no, I just never felt like that was my thing. So I didn't know where I belonged.
Yeah, that's interesting. I totally forgot that you were a flight attendant first and nursing was a second career.
Mm-hmm.
And so I'm curious, when you say that back then, aesthetics wasn't really a thing, is that because it just wasn't being done, or it wasn't being done by nurses?
Well, both. It was being done. It just wasn't popular, and it was still kind of taboo. So let me back up a little bit. So as I'm in nursing school and I'm working in the hospital, I take a girls' weekend trip to the beach. And we're at the beach and we were having cocktails and we go back to dinner, and I look in the mirror and I was like, what is on my face? I have a mustache. And blotchy. And I'm like, oh my God, what happened to my skin? And I wasn't a big skincare. Now I'm like a vampire. People tell me, oh, you're too white. That's fine with me. I'm anti-sun. But yeah, it was melasma, and I had so much sun damage. And so I found a place in North Carolina that offered laser treatments. So I went in there in a panic, and I'm like, I don't know what happened to my skin. What can I do? And Obagi had their new derm kits, and they had a laser procedure called IPL. And so I am 52 now. I just turned 52 in April, and I was 30 at the time. I remember it was the year Botox got their cosmetic indication. And I was in there for a laser treatment, and the provider was like, hey, we have this sale on Botox. And I'm like, what's Botox? She's like, oh, it just makes you look rested. And she's like, oh, it's sale, rested. Well, I'll try it. And I'm so thankful for that, because we talk about prevention with these procedures now. It's not being a Vermont girl. That was not something that I would have actively went seeking. But it was on sale. I thought I'll try it. And as it hit in, I was just at that age where I didn't have wrinkles, but I just felt like I got a month of sleep. And I loved it and I was hooked. But then reality set in that I wasn't really working much as PRN. And I'm like, okay, can't afford this. What am I going to do? So fast forward, when I'm in nursing wanting to do these procedures, I answered a Craigslist ad for a laser nurse in this little town with a 72-year-old ENT. He's just darling. And yeah, I applied to the Craigslist ad and met Dr. Hutchins and started doing his laser. My whole thing was, I'll learn to do lasers and then I can get a discount. And that's kind of how it started, but that is certainly not how it ended.
Well, I can completely relate to that, because I am 32 and I'm just starting to feel like my face is looking older, and I just got my first Botox treatment this year.
Oh,
but
yeah,
it
baby.
does
Yeah.
yeah, it comes with a price tag. So it's funny that your own experience kind of jolted you into that industry. And so once you took that first Craigslist job, what from there?
Okay, so I'm doing lasers, which hindsight's 20/20, right? So I'm doing lasers, and I shouldn't have been doing them. You don't know what you don't know. And laser procedures, people think they're so easy. They're not. You need to know the depth. You need to know the chromophore, what it's attracted to. Is it pigment? Is it water? You can cause burns. You can cause scarring. There's a lot of different, especially today, a lot of different platforms and modalities that we can use. And I just didn't have the proper training. So I was doing laser hair removal, IPL, dinosaur skin tightening, and tattoo removal. And I was happy. It was fun. It was something different. It was a private practice. It was no stress. I really liked it. But my doctor was doing some injecting. And I was like, oh, no, I was petrified. And it's so funny because there's people that are, because I teach a lot now, that are like, oh, I'm afraid and they need to be handheld. And then there are people who are like, oh, just let me at it. Like, give me the needle. And I didn't want to do it. So finally, Allergan, the maker of Botox, sent one of their trainers in. And she is a dear friend of mine now and has an amazing training center for newbies here in Hickory, North Carolina. And she came in and did the training. And I was like, I like this. But every day I knew it would take up to 2 weeks to kick in. I'd walk in and go, did anybody call? I was so petrified of dropping someone the brow. I mean, I was petrified. And when I started seeing patients come back and they were happy, I'm like, oh yeah, yep. It's like, this is in my blood. This is what I want to do. But there was no place to get training. You could get a company sponsored training, which will give you the basics of our FDA indications. But they're not going to do this deep dive into all of the anatomy. I mean, that's not possible in a 4-hour training. So I started looking online for, innovative Botox classes and anything I could Google. And I found a training center out in California. And I told my husband, I said, and I want to do this, but I need to learn to do it right. And I can't find anything, but there's this place in California with this nurse who's been doing this forever. And he's like, okay, let's go. So my husband and my 2 kids and my husband and my dad were my model. We packed up, we flew out to California. I stuck them, injected them. And I was like, okay, now I know this is really what I want to do. So there were some conferences available back then, but I didn't know anybody and didn't have the resources. Like, okay, so different set of challenges that people have today. They're overwhelmed by choices. I didn't have any. I went on good old LinkedIn. And this is the funniest story because the OGs of this industry, there's like 15 or 20 that when I say OG, they're like 20, 25. My friend Luann's like 31. I'd reach out and say, hey, and they're the messages I get today. So it fills my cup. I answer everyone. And I met this lady, her name was MK, and she's like one of the godmothers of aesthetics. And I said, my name is Heather Rypien. I want to get into aesthetics. I found you online. Would you mind answering questions? And she's like, oh, girl, this is more than an email. Do you have time to talk? I'm like, yeah. So she sat down and spent, an hour and a half on the phone with me, answering every question I had, pointing me in the right direction. And I have to credit that woman to getting me into this space the right way. And I think of her every time I have the opportunity to pay it forward, because she's come up instrumentally in my life, even for the positions that I have today, because I live in North Carolina, but I have worked in New York City for the past 10 years. I've commuted up there every week for 10 years. So yeah, it's just like this, my story is like all over the place. It's like, squirrel, where were we? But I mean, it was just a very unique, and even you talk about Beyond the Bedside, I think I've taken a unique approach to do what I've done within this space today, because I don't just practice in one practice and I don't just do company sponsored trainings. I've kind of grasped and ran with being innovative to do the things that make me happy and that keep me going, because I'm just not that personality that can have a mundane, monotonous schedule at the same office every day. I would just go crazy. So yeah, that's so if you want to pick something from that and throw it at me, go ahead.
Yeah. So I want to get into how you transitioned to the office in New York City. But first, I'm thinking about the listeners who might be tuning in and hearing, okay, she was interested. She answered a Craigslist ad. She found a training in California. Okay, so, but how would you, if someone's listening and they're like, okay, but how do I find a training? How do I find my first job doing this? What advice would you give to someone who's trying to break into that specialty today?
It's difficult and luck, and you have to be patient and you have to do your resource. And if you're lucky, and people can reach out to me as long as I have it in me to, answer, because I stay so busy, but you need someone who really wants you to succeed and be honest. And we talked about this before coming on here, the good, the bad, and the ugly. Why do you want to do this? But finding a true mentor to point you in the right direction, because right now it used to be, okay, there was no place to get training. And then it was like, okay, can I find a job? And you couldn't find a job. We had a whole different thing. And then practitioners were in competition with each other for patients. And now, because you can make, it is lucrative to teach. It can be very lucrative. So now everybody wants to be a trainer. And there are training centers popping up on every corner, almost like every med spa. And there are phenomenal training facilities, and there are ones that I would never recommend someone going to. If you're doing this for the right reason and you want to be successful, nothing's easy. You're going to have to pay your dues somehow, either working for less money up front or investing in yourself and paying for that training. There is no shortcut. There just isn't. And there have been a few people during COVID that made their mark on training and platforms like Patreon and stuff. And they did get very lucky and they become Insta-famous. But Insta-famous does not mean quality provider. So I think you have to find your why. What is your goal? Is your goal, I want to be a provider. I want to learn this and become a trainer. And then you have to know if patient safety, patients are the reason we do this. And I get frustrated sometimes in this space because I think that a lot of providers send out a false message that everyone that aspires to do this is going to be carrying designer bags, wearing $1,000 suits, jet setting everywhere, going to clubs, VIP. Yes, that does happen for some, but that's a small percentage, and so you really have to think, I have to pay my dues. What is my goal? What does success mean to me? And you have to remember that the patients are the core of why we do this. To me, there's multiple reasons patients come in. I get men that are in sales that feel like they're in competition with younger men and they're not getting positions because of their wrinkles. I have women that have recently been cheated on, have gotten divorced, they're widowed. I have high school reunions coming up. I have weddings. There are so many reasons. You have to dive deep because I love to tell my patients, I can't fix what's broken on the inside by fixing something on the outside. So there are so much clinical applications into this. You kind of have to be a psych nurse. You have to know your anatomy, but you have to, at the forefront, have the patient's best interest in their safety. So there is a fundamental piece, and that's anatomy. The science is science. I think a lot of patients are looking for deals and think that this is like going in to get a manicure, pedicure, a haircut. It is not. And I refuse to offer discounts and offer sales. I don't ask my OBGYN for a discount. This is medicine. And I think there's a limited opportunity because those of us that have been doing this for so long and the people before me that are my mentors, we are beginning to be outnumbered by the new people that come in. So any chance that we get to mentor someone, because we're not going to be doing this forever. So we want excellence in the next generation and the legacies of injectors that come behind us. So it's like, that's why we're passionate about saying, guys, you need to find a mentor. You need a quality anatomy class. I am one of the top utilized trainers for one company in the country for the third year. I trained, I think, over 100 practices last year. I could train somebody from the ground up, but probably not the best quality they could get. I can't take money from someone and provide them in 4 hours or 6 hours or one day what they need to be a safe practitioner. So I think that they need to find a comprehensive program. I do not think, in my opinion, anyone should pick up a needle and have someone go needle to skin, point right there and shoot. Yes, that's the fun part. We like to see people look pretty, but we have to get there the right way. So finding a place with tangible takeaway materials, anatomy goods, cadaver courses, learning about the science and the rheology, the science of the gels is very important. We have to know, why are we getting the results we're getting? Is it because we're supporting a ligament? Are we taking care of a depressor muscle? Once you learn that, you can look at any trend and you can self-create. You can be like, that's where the innovation comes in. The non-negotiables are the science, the anatomy, and even anatomy is variable. But when you can look at something and go, oh, someone just trademarked this XYZ thing, and you're like, I can see what their injection points are, but you understand how they achieved that, that involves critical thinking. That involves science. That involves patient safety. That's the practice of psych medicine. So people that want to get into this need to find a program that does this the right way. And I think that comes with doing research, finding mentors, reaching out. You might get a lot of no's, but the one yes you get is probably from someone that wants you to succeed and cares about the space.
Yeah, and I love that you gave us some like tangible things to kind of look for in the right type of program, like what they're teaching and how they're having you train.
They want someone, the longer they've been doing this doesn't make them the better, but let's just say, I think you'll never be more confident as an injector than your first year. There is an exception. Some people are scared, but usually you're really confident, you're excited. By your second year, usually something goes wrong. It's not a matter of if, it's a matter of when. And then you get humbled a little bit and you go, okay, now I'm ready to learn. Now I'm ready to like listen. Because you get excited and you're cowboyish and you're whatever. But the things that we come is there are far better injectors than me. They're probably far better trainers than me. But I do have 15 years and I'm in so many clinics. I've seen a lot of stuff that I wish I didn't, but I'm glad I did. And I like to share the bad because every time I inject someone, I'm thinking, is it worth it? Because I know the safest stick is the one that you don't do. Thankfully, we are coming into a trend of natural. And so we're getting away from seeing these big lips and everything. But a lot of that was improper injection because we didn't have FDA approval to cover all those areas. So we piecemealed it, which makes this very complicated for a newer injector because I sympathize with you. We had 4 hyaluronic acid dermal fillers. We had a Radius and we had Sculptor, which is a biostimulatory product when I started, and 2 neuromodulators. We had Botox and Dysport. And so every time we got a new indication or a new product, we kind of had an intimate relationship with the other ones because we used them exclusively. It's all we had. But now coming into this space, I just did a presentation at a conference and I can't remember off the top of my head how many products there are. And so you have to jump in and have conversations with these reps. Do you know the difference between a research paper and a white paper? Do you know the questions to ask when they try and sell you their product? It is overwhelming. It's overwhelming.
Yeah, I can imagine. Well, I think that is all a very important takeaway for anyone who is listening here today who might be interested in kind of following in your path. And you also mentioned, why are you getting into it? What is success? At that early stage in your career, did you know yet what success looked like for you?
No, but I also didn't know what to ask myself. So I always, when I do, depends what kind of presentation I'm doing, but I always like to throw this in. Telling my younger self, the mama and me, is like, close your eyes and think, if I had my dream job, at what point? Is it X amount of money? Is it to live here? Is it like, what is your goal? Because especially in this space, there is no other place in medicine that I've seen the bougie lives that you see here. Trust me when I say this. And there's always going to be more. And the amount of money that some people make doing this is insane. It's more than surgeons make. But is it sustainable? Is it a trend? Training's a trend. Your patient loyalty is sustainable. And I think it's always grounding yourself because I like to share my story that I had a couple good things happen. I've had some opportunities that I dreamt about, but there's always more. And it started to identify me. And so I really embrace now that I would rather work to live than live to work, because what I do is not who I am. It's a big piece of me. But especially in this space, there's always another conference. There's always another this, and someone's doing this, and I want to do it better. It takes a strong personality. So going into this, I think it's really important for new providers to have clear-cut goals and aspirations. And if they have that personality, if it turns into more, great. But don't let it consume you because the market's saturated and it's very competitive. But you have to do things that make you different. I tell people at the marathon, everyone's going that way. Be the one that turns and goes back, because good old customer service and kindness and no ego. I mean, that's just like the golden rule, right? And people get so caught up in being the next big trademark. And I did this and I'm doing this. They forget that the simple things sometimes are the big basic for sustainable success. And so I love that flight attendant customer service background because that has really helped me.
Yeah, absolutely. That's a golden nugget. And I think that you're so spot on with, just people needing to, no matter what they're thinking about pivoting into, I do think that it's really important for people to identify their goals and try to create that image of what success looks like, because I'm completely on track with you with work is a part of our life that should fit into what we're trying to optimize our life for. And work is important. It's an important piece of that puzzle, and we should be enjoying what we're doing. And as nurses, we always want to feel fulfilled with what we're doing, which is, I think, a fantastic trait of nurses. But it is important to remember that it's a piece of the puzzle and it all fits into the big picture, and you need to have a clear idea of what that big picture is. And so talk to me about how you ended up having a dual city practice between North Carolina and New York.
Actually, can I back up for 1 minute? Because I don't want to forget this.
Yeah.
It's really important for providers. Please hear me if you don't hear anything else I'm saying today. If you aspire to get into this space, you need to know that there's no such thing as a certification. If you see something saying, get your certification, ask them, certified in what? This is one of the places in medicine that there is no certification. Dermatologists, plastic surgeons, ENTs, nurses, PAs, there is no fellowship, there's no internship, there's no credentialing. The only thing that we have that unfortunately PAs can't sit for is the Certified Aesthetic Nurse Specialist program. That is a certification to the Plastic Surgical Nurse Society that you can get after you have X amount of numbers with a core provider and hands-on patients. It is something that is not required, but that's something you should look for if you're seeking these services, or if you're looking for someone to mentor. That's a big takeaway. Is how many years have you been injecting? Do you have your certification through the Plastic Surgical Nurse Association? Not mandatory, but great to have. And just be wary of that get certified. You can have a certificate of completion of a course, but going to take this is not going to make it legal in any state. And RNs, you need to also do your research. There are no uniform state laws. Federal. They are individual state laws. Good faith exams, face-to-face exams, written orders. There is a lot to unpack to make sure that you're practicing safely and compliantly. So that's another one, because what we're seeing is it's not unheard of for someone to go to nursing school for the sole purpose of injecting, which is hard to me. I don't necessarily think that's a great idea, simply because you need to make sure that you have a fundamental understanding of someone's well-being and be able to go through do a comprehensive physical and notice if someone vasovagals in your office, if someone has a seizure, if they, see light from a laser. I've had it all happen to me. So you do need to incorporate bedside nursing into this. And I love seeing nurses transition after they have, a strong clinical background, because there are some people that are going from RN to NP, never really practiced. They get out and get frustrated because they can't find someone to hire them, and they just go open their own practice. And they are asking clinical advice and showing before and afters, hopefully, and they do say with permission, asking people on Facebook forums, what would you do? What happened here? That to me is scary, because you're asking a forum from clinicians that you don't know their experience level. And it kills me. I sit there and I'll see 20 different answers to something. And I'm like, okay, I have this lesion. What is this? Is there anybody with derm experience out there? It's the wild, wild west. So you really need to know what your laws are. And that's just something to think about if you're transitioning. Like I said, nurses that have some experience, they're such a blessing. Not to say that there's not a space for new people, but I really think that clinical background helps. So I think those were some important things to throw out there for people, thinking about this.
Yeah, absolutely. I'm glad that you gave us that. I think that's really important for people to know as well. It is different from, a lot of nursing is so regulated and regimented.
Now the nursing board will come in and slap your hand, pull your license, fine you. And sadly, it's not because people are being non-compliant. They don't know. And it's
right.
it's not black and white. It's gray. Example, in Florida, RNs cannot inject. NPs, PAs only, under a physician. However, now they're saying that if a nurse has been doing this, they can petition to the board for permission. So that's a gray area. In New York, I have to have a patient-specific order. In North Carolina, I can have standing orders. but a good faith exam, because Botox, dermal fillers, they are, dermal implants, they are prescriptions. And if you are not a prescriber, injecting those is a federal offense. And so, like I said, a lot of people just don't know. So that's why I share this as, I just keep going, oh, I need to say this. Oh, I need to say that, because it's really hard to navigate that. And, it's like people spend a lot of money going through attorneys, and even contact a compliance attorney, you might get conflicting information. So you really need a support group, a mentorship, and really spend time researching.
Yeah,
so
absolutely.
And so now you want to know about my New York gig, huh?
I do.
Oh, okay. So I worked with my ENT, laser, started injecting, fell in love with it, but there were not a lot of opportunities in this area. There were surgeons doing it, but some of the top surgeons in Charlotte today were just finishing up fellowship. So, they were still kind of baby surgeons, and they couldn't support having an injector in their practice. Like, what does that look like? And so MK, the one that I found on LinkedIn, I told her that I'm like, MK, what do I do? Like, I did all this, I met all these great people. And she says, I live in Chicago, but I see patients in Phoenix. And there is a top plastic surgeon in Manhattan, actually on Park Avenue, that's not advertising, but on the DL, like through word of mouth, he's looking for someone. And I was going to do it. It's too much. What do you think? And I'm like, okay. She goes, I'm not going to tell you who it is, but let me reach out to him. And he called me, and I was driving, and he was like, hey, Heather. And it's Steve Perlman, and he's a facial plastic surgeon who's really known for his rhinoplasty and rhinoplasty revisions. He's a phenomenal surgeon. He said, well, when are you going to be in New York? And I said, well, when do you want me there? And he says, what about Wednesday? I'm like, okay, that sounds good. I'm like, oh my God, what did I just do? So I come home, and I'm like, I tell my husband, I'm like, I have an interview in New York City. He's like, what? But because we followed for a living, it wasn't like, we're like, okay, we'll go. And I said, I've never been to New York. I'm like a Vermonter, like live in the country in North Carolina. And he's like, I'll go with you. So we flew to New York, and we went into the city, and he's so sweet. We took the train, and he made sure we found the building so I would know where to go the next day. Fast forward, I spent the whole day interviewing there. And when I left, they were like, could you see yourself as part of our practice? And I said, I could. So I walk out, I'm like, oh my God, I just took a job in New York. Like, what am I doing? I don't even have a place to live. So the office manager at the practice put out a social media thing saying, hey, we have a new provider at our office. Does anyone have a room to rent? I got a roommate, and I started flying up to New York every Monday, saw patients Tuesday, Wednesday till 3 on Thursday, and took the 5:30 flight home to Charlotte. I'm like, I will do this for a year, get some experience, and then I'll come back to Charlotte. Surely by then there'll be more opportunities. I got so busy in New York because there were not med spas, but it was vacuuming. There was not, my Instagram is Park Avenue RN, because Instagram started being a thing when I had that job and I needed something. And I'm like, okay, so Park Avenue RN. And that's how I got it. But I had to grow my brand in my practice organically through Google reviews, through word of mouth, just seriously picking up patients in the airport, at the Admiral's Club, on the airplane, on the street. It was a grind to do that, but once it started to go, it really took off. So 1 year turned into 2, and 2 turned into, okay, it's time to get my own apartment. So I got my own apartment, and then we turned into 9 going on 10. And in April, I got rid of my apartment because I said, I just can't do this anymore. I'm 52 years old. I teach all over the country now. And so I was on an airplane sometimes, 3 times, 4 times a week. And I was like, I need to come back to my family, but then my kids are grown. So I found a surgeon in Charlotte that I thought, you know what, your goals and your approach to patient care and safety is like mine. I think this is going to be a great fit. So started seeing patients again part-time back in Charlotte, and I now go up to New York City once a month instead of every week. Yeah.
Wow.
And then I train.
That's a lot of back and forth.
Yep. I'll tell you though, I have the best patients. Oh, and are they loyal? I had a patient that flew in from Pensacola to Charlotte. She's done it twice now, and she comes in and I'm like, hey, and she's like, do you remember me? I come from Florida. I got in last night. I stayed across the street at the hotel. She gets Dysport and flies home. She's in her 60s, and she's never been injected by anybody else. And she knows I'm the queen of no. If I say yes, I like saying no, less is more. And I have never treated a patient thinking I was going to make money on a procedure. I honestly love this. And the money has just come, and it's been financially lucrative for me just doing the right thing. It might take longer. You may have younger patients. They will age. So it's like building relationships. So I don't see a gazillion patients, but I see quality patients. And when they fly in from Florida or they come in for that procedure, it's because they trust me. And so I just really have grown a loyal grape, and I just can't abandon the ones that aren't going to fly here. And I'm with an oculoplastic surgeon now that's, in my opinion, he's the top oculoplastic surgeon in Manhattan, and I adore him. He's just a good dude. Like, he respects me. I can feel appreciation every time I go. And as a nurse, to be respected by a surgeon like that and to go into work saying, this doesn't feel like work, this feels like family, really hard to find. So I can't give it up.
Yeah. You know, something that I hadn't really thought of, and I'm sure that some listeners today are probably in the same boat, and I'd say this is maybe because of just like the popularity of med spas popping up everywhere now, but I hadn't ever really considered, which I don't know why, but I hadn't really considered that like customer loyalty and customer relationship going that long term. I mean, it makes total sense. Like, I fly to Denver to get my hair cut. So like, of course, it makes sense that people would fly to see you for their injections.
Yeah, Connie Brennan's probably one of the first injectors in this country. And she has seen her patients through marriage. She's seen her through having their children now get married and prepping them for their weddings, and her patients becoming grandparents. Like, how cool is that? And her daughter became an injector, and she just finished NP school, and she's carrying on her mother's legacy and taking care of her mother's patients. And to me, I mean, that just gives me the feels and the chills, because I mean, they love their patients and their patients are safe. That's why I can't do a discount. I have spent so much. I mean, when I couldn't afford trainings, I volunteered. That's how I became a podium speaker. I first assisted on the stage, and I worked harder than a day in the ER, handing 9 surgeons and nurse practitioners and PAs syringes and keeping that straight. But I had a front row view. I didn't get paid, but my conference was free. I did anything I could to put myself in anything I could so that I had opportunity. And so, you know, it's like, when I sit down with a patient, I spend so much time educating and telling them stuff. And I know I meet them where they are. I mean, some people are like, okay, I really don't want to hear about the neuromuscular junction, the release of acetyl. Okay, I don't do that unless I have a science nerd. But they get all of their options. First of all, you're beautiful. You don't need anything. But if you do, like, what's your goal? What's your favorite thing about your face? What would you like to see change? Let's come up with a treatment plan. I won't do something if you're not going to see a difference, because you're going to walk away thinking you waste your money. But I don't need your money. I mean, I want your money, but I don't need it. So we're a team. And if they're in doubt, I go, you know what? This isn't a decision-making chair. Go consult other places. And if I'm your girl, like, come back. Most of the time, patients will go, I made my decision. Because who else is going to do that, right? Mm-hmm. But I don't want someone to have buyer's remorse. I don't want someone feeling they got pushed or they were uncomfortable to tell me no. It's all about them, and I let them dictate, as long as it's going to be natural, what their comfort level is, and then I'm honest. And if I feel like I can't meet their expectation, if I can feel like this is just, there's a red flag there, I am all about saying no. And I'm thankful, because as a younger injector, I probably wouldn't have had the confidence to do that, because let's face it, everyone's so excited to get started. That's why they do sales. But I'm thankful I am where I am now. But spending that extra time has got me those loyal clients. I don't have 30, 25-year-olds that want, you know, Kylie Jenner libs outside my practice. That's not my brand. And I do know that there are some people, I've had patients go, but I don't want to look natural. I want to look done. And I just say, and I respect that, and I could do it. But for everyone that loves that look, my brand, most of my patients don't prefer that look, you know, and I'm just very honest. And I think it's just the delivery of the message. But again, that's what I love about this space. You can use critical thinking. You can be at the art. You can be innovative, you can be creative, you can practice psych nursing, you can, you can dive deep into their medicines, their medical history. It's what you want. I mean, if you want to, you can really do everything that you want in healthcare with this. So obviously you
Yeah.
could tell I'm passionate about it.
Absolutely. Well, sounds like you're great at what you do and your patients really love it. I think that it's cool too, just the aspect of your personal brand as a provider and people getting to like choose you for that. And I know that, you talk about saying no. Like, what are some of the things you say no to? Like, it sounds like you really value remaining pretty natural looking. Like, are there dangerous things that people are asking for? Like, when do you say no?
So there are some procedures that I'm just not comfortable doing. People do them, they love them, beautiful result. I like to sleep at night. So danger zones, I don't do non-surgical rhinoplasties. I mean, I don't. It's one of the leading places that can lead to blindness, and I'm just not comfortable with it. And it's not something that makes me lose patients. And if my patient wants that, I'm happy to refer them out. I think that collaboration in this space is amazing because there are things I love to do that some of my colleagues don't. And the sad part is they say nurses eat their young. And there are a lot of people that are community over competition and like to collaborate, but then you do see the opposite. But if I have a patient come in that they went to 7 places and they didn't do it right, chances are I'm going to be number 8. Someone who comes in and they're emotionally upset and making emotional decisions that are situational and like a crisis situation, no, that's not the best time to do something to your face. So I really need to understand their why. Like, why are you wanting this? And it's not me to judge. I don't judge, but I am not doing something that I think leaves potential for regret with my patient. So that's a big thing. If they have been to another provider that I see migration of lip filler, no matter what I do, that filler needs to be dissolved. It's not going to look right. And I know that they don't want to go through the dissolving and their lips are going to go away and lines are going to come back. But I'm sorry, there's no shortcut. That's the way it needs to be done for it to look natural and for it to be done properly. And if you don't have the patience to take that journey with me, I'm not going to do it. Just overdone, coming back too often. This is funny. There's a big trend right now for younger people have you heard of baby Botox?
No.
So baby Botox is when they're saying they're coming in and just getting a sprinkle. I'm like, okay, so this is where I educate people. I'm not doing it. If you want to come in for a lip flip, which is typically with me starting dose 4 units, like a unit. If you are triggering an immune response and you continue to do that every 4 weeks, every 6 weeks, there is a potential that your body's not going to recognize that anymore and you're going to become a non-responder, which we have seen a rise in since COVID a little bit. So it's not healthy to be doing something all the time. So I'm like, you're not going to come in every month for an area. You're going to come in and do everything. And then I would rather see you less frequently and do it correctly. So I say no in circumstances like that. And I say no when someone's going to try and dictate to me what they need. Because when we age, we see the presentation of the aging process and we may know, oh, this bothers us. That doesn't mean where you need to be injected. So no one's going to tell me, oh, I want you to put some filler. No, we have to understand why we're placing it. So I don't let patients dictate treatment plans. I let them tell me because they're the expert in what they feel, but I am the provider and it's my responsibility to make them happy. Does that make sense? Mm-hmm. So there are a lot of reasons. There are big conversations. It's not just going in and paying $3.99 for all your areas unlimited. And the product is so expensive. I don't even know how anybody can offer that. I really do not. But there's been a crackdown because some providers are getting their product overseas and illegally. A counterfeit. There were just I think there were either 6 or 9 women hospitalized for botulinum toxin poisoning that were hospitalized for counterfeit Botox.
Ooh, that's scary.
It's very scary. There are high risks associated with some of these procedures, and you need to know. I tell every patient, there's a benefit and a risk, and what I'm going to tell you might scare you. And it should, but I would be more afraid of the person that promises you something can't go wrong. it's going to make that conversation so much easier to have when something does go wrong. So, it's patient education, and it is informed consent. So, and someone that's not willing to take the time to sit down and have that conversation with me probably is not going to be a good fit for my practice either.
Yeah. I mean, that goes back to the fundamentals of what we learned in nursing school about informed consent.
Yeah. And it's medicine, it's nursing, it's patient care. But like I said, I've shifted my focus. Like, I love my patients, but I love to teach. I love to teach. That's like training's a passion of mine.
How did you establish yourself as a speaker and teacher?
I'm trying to think because it's been so long now, but so there's one pharmaceutical company that I went out to a training and I met, and my rep back from 15 years ago, she knew I was always that, like, I want more. I want to learn more. I want to do this. I love to teach. It's just part of like who I am. I love the specialty. And I got you need to be usually recommended to be a trainer. And so I got recommended to be a trainer, and I did my first training in New York. And then I did like a speaker dinner in Kansas City. And I was out there with one of the managers for the territory. And I spent a lot of time talking to him. He's like, would you come out to Kansas City and do a training? And I'm like, yeah. So I did, and I got good feedback from the people that were there. And so word of mouth, one rep would tell another one. I used Heather, she did a great job. And the next thing I knew, it just happened. And then conferences, I would volunteer to work, and then I got asked to speak. And then the floodgates opened of opportunity. So, I mean, I've been in Fargo, North Dakota. I've worked in Hawaii. I've taught, Kansas City, Connecticut, Massachusetts, Vermont, New York, like you name it. I haven't done anything in Florida. I'm an RN. I can't inject, but I've been everywhere and I love it. Like, I'll go and I'll do like 4 or 5 back-to-back trainings, and I'll be gone for a few days, knock them out, and then I come home so that I can kind of compact that all like in a month. But like I said, I did over 100 last year. But I don't know how
favorite. I don't know how you fit all of this in your calendar between North Carolina and New York and your trainings.
It's insane. I just did a training in Connecticut Friday. I spent the weekend. I came home. I'm going to see patients for 2 days, and then I'm going to Ireland. I'm doing my first international talk in Belfast next month. And then I'm coming home, and I'm doing a cadaver class. I'm faculty for cadaver class in California. Then going to the Northern California, and then back for International Society of Plastic Surgical Nurses, and I'm speaking there. And then for the rest of the year, I'll teach a little bit, but I'll just focus on my patients, and I'm in school full time. So it's crazy.
Yeah.
Like, this is my idea of slowing down too. So
yeah, that's nuts. And being in school on top of it, what was your push to go back for your NP at this point?
Job security. I just feel I didn't want to. I've been back and forth about this for 8 years, maybe longer. We didn't really have to worry about it because we didn't realize that we were practicing outside of our scope, because most of us were with surgeons injecting. And then as the med spas started to open, experience started to go down, and competition, and people turning each other in, and negative patient outcomes. And so I will tell you, like, a driving reason to probably be at NP is to not have to do good faith exams and have more autonomy. And if you want to open your own practice, which I absolutely have no desire to do. I am not going to reinvent the wheel in my 50s. I don't want to, but I'm doing it kind of to be a role model to people that, if we want excellence, I never thought that I would be one to say they need to take nursing, injecting out of the hands of nurses. But if nurses don't start doing this the right way and learning and being safe, ethical providers, then maybe they should make it a little bit more difficult. That's why I do stuff like this with you. I want to make a statement to say, this is how you do it right. Because again, you don't know what you don't know. And people anxious to get into this are going to spend $10,000 on an introductory course. A lot of training's about it can be $500 to $1,000 an hour. And so if you can't find a place that's going to provide training for you, which usually comes with a non-compete, which they're getting rid of, or a non-solicitation, or you need to stay here for 5 years situation, that's a whole nother ball of wax. But, there needs to be some standards because people are giving their money away. And sometimes I get these phone calls or messages on LinkedIn after the fact. I spent all this money and I didn't learn anything. I can't find a job. What did I do? So any opportunity to try and help somebody do it the right way and save them pain, suffering, and a ton of money, I'm all about it.
Well, I really love your passion for and commitment to excellence. I mean, it definitely shines through in, not even just what you're saying, but everything that you're doing with your career too.
And as much as I respect you for what you're doing, because there's so many nurses that are like, I'm going to not be a nurse anymore. And I'm certifiable. I Googled nursing outside of the box jobs. I mean, just what you're offering for these people, I think is such a gift because let's see what else I've done. I was a camp nurse for 7 years for my boys.
Mm-hmm.
I loved camp nursing. For nurses with young ones at home and camp is like $1,000 a week, go be a camp nurse. They get to go for free and you get to have fun with them. I think it's one of the most rewarding things I ever did with my nursing license. And then I did chart audits where I went around to different clinics and scanned them for insurance reviews. I mean, those are just a few things, but listening to your lineup and your podcast, I'm like, there is so much that you can do as a nurse. So whether it be what I do or what you do, I think this is a great opportunity for people to have exposure, to do their research and dive deeper in from people who can share their legit experiences. So
Absolutely.
Thank you. I commend you for doing that. That's just an awesome service you're doing for all nurses.
Yeah, thanks. I mean, I learned it from my own journey. I had, I think, a similar Google search of, remote nursing jobs or like non-traditional nursing jobs. And, you see some in those searches, but there's so much more opportunity out there, so much more opportunity than what you're going to see pop up in those results. So I think that, this is a really cool platform to have nurses come on and share.
And it has to be fun for you.
Yes.
I mean,
absolutely.
I'm sure you're enjoying doing it because I mean, I feel like I'm sitting down with a friend just discussing it. This is what I tell everybody if they were to call me, and like I said, I feel, I try not to get jaded, but I would be lying if part of me does not say I get frustrated sometimes with some of the stuff that I see that just doesn't send the right messages out for patients. I mean, I understand that social media is a necessary evil. I keep it because if I move, my patients can find me. People can reach out to me as new patients or as new, people that want to be practitioners. But the trends and the TikTok dancing and the unprofessionalism, my patients have said I would lose respect for you if I saw you doing some of that. And the message that you're sending out to potential people that want to be providers in this space, thinking if you do this, like I mentioned at the beginning of this, that you're going to be designer bags and a millionaire, like that's not true. Is it possible? Yes. Is it going to happen for everyone? No. Find your why. No matter what you do, you're successful if you're doing it because you're passionate about it. You can't fake that. You can't fake it. Yep. That's why my favorite is to work with providers that probably usually have about 2 years experience because they know just enough that I can go over, okay, let's reinforce that your anatomical landmarks are there and they're accurate. You know what this feels like. Now I can tell you why you would use this product or the other. I like to fine tune skills or teach them a new procedure because that's the thing is even when you get going, you need to see it done 50 ways to pick one to make your own journey and your own path because a lot of this is artistry. So that's my wheelhouse. They're my 2 years and up. But the rest of them, I love the opportunity to say, I know some of the best in the country. I know who's been doing this the longest. I know who's in it because they really want to help you. And I love being able to share that.
If you'd like to connect with Heather after today's show, you can follow her on Instagram at Park Avenue RN or email her at hrypien@gmail.com, both of which can be found in today's show notes. Thanks for tuning in. Don't forget to hit subscribe to keep up with our latest episodes. And if you were inspired by today's conversation, I hope you'll share this episode with someone who'd love it just as much as you did. If you're ready to pivot your path, visit the job board at jobs.mypivotpath.com. And if you have any questions or just want to say hi, feel free to email me at audrey@mypivotpath.com. Thanks for listening, and we'll see you next time.